Hello, my name is Jason Vanstone. I am a research scientist with the Saskatchewan Health Authority's Antimicrobial Stewardship Program based in Regina. On behalf of the research team shown here, I'll be presenting the findings from our study entitled The Viral Prescription Pad, a mixed method study to determine the need for and utility of an educational tool for antimicrobial stewardship in primary healthcare. The study was published in BMC Family Practice in 2020, and you can scan the QR code to link directly to the paper. Antimicrobial resistance is a problem of global concern, and we know that antimicrobial resistance is driven by antimicrobial use. In Canada, approximately 90% of antimicrobial use occurs in the community. We also know from studies in the US that at least 30% of outpatient prescriptions are unnecessary, and this number could be as high as 50%. Locally, in Saskatchewan, we are the second highest user of community prescribed antimicrobials in Canada if you combine the maritime provinces. Taking all of this together, we know that we have room to improve the appropriateness of our community-based antimicrobial use in Saskatchewan. In order to address this concern, we first set out to determine what should an antimicrobial stewardship program even do in primary healthcare. We surveyed dentists, nurse practitioners, community pharmacists, and family physicians in Regina and throughout the province for their input. Veterinarians were also included in the survey, but their data are not included here. Next, we took the information we learned from this survey and developed and implemented various tools and resources to address the antimicrobial stewardship needs of the community healthcare practitioners. About a year after we began the implementation, we performed telephone interviews with Regina-based family physicians to understand their perceptions of the utility of the antimicrobial stewardship tools and resources that had been made available. These interviews tended to focus mostly on the viral prescription pad that had been developed. Finally, we performed a patient survey to better understand the medium by which patients preferred to receive information about symptom management for upper respiratory tract infections, one of the most common reasons for unnecessary antimicrobial use in the community. From the primary healthcare provider survey, we found that more than 92% of respondents in each provider category, dentists, nurse practitioners, community pharmacists, and family physicians, agreed that the public needs more education about appropriate antimicrobial use. However, around half of the respondents in each category indicated that they were not equipped with the necessary tools to help educate their patients. Additionally, more than 80% of respondents in each category indicated they would be interested in continuing education opportunities around antimicrobial stewardship. So we went to work putting things into practice to address these shortcomings. We developed educational presentations to provide to the public, including elementary schools and high schools, healthcare trainees, etc. We developed a suite of tools like the viral prescription pad and other informational pamphlets, which we made available on our website, but also with the help of our local colleagues in primary healthcare, we delivered stacks of handouts to family clinics throughout Regina. And we also set out to host, in collaboration with other provincial and national partners, a One Health-focused antimicrobial stewardship conference to provide stakeholders in Western Canada a place to congregate and share ideas. After about a year, we interviewed family physicians in Regina to get their thoughts on the utility of the antimicrobial stewardship tools and resources that had been made available. These conversations tended to focus mostly on the viral prescription pad, which physicians indicated was the most useful tool. Physicians thought that it was very useful for educating patients about when antibiotics are required and when they are not. Physicians also indicated that they felt the viral prescription helped patients feel like they had been heard. This person said, "We can write specific instructions to them so that they know we're not just dismissing their symptoms. We recognize that they're having a tough time, but they don't need any antibiotics." Physicians also thought the viral prescription helped patients by giving them something tangible to leave with from their visit. One person said, "Sometimes people leave the office and they don't remember everything that you said. but if they have the prescription, they're able to refer to it. Interestingly, some physicians indicated that they actually don't provide the physical prescription, instead opting to provide only verbal advice to their patients. This information set us on our next course, which was to ask patients how they preferred to receive this sort of information from their care providers. When we asked patients how they preferred to receive information about symptom management for upper respiratory tract infections, about 76% indicated they would prefer written instructions or both written and verbal instructions. Only about a quarter of respondents indicated they prefer verbal instructions alone. 94% of respondents indicated they would like to receive a handout like the viral prescription, either with or without verbal instructions, to help understand symptom management for upper respiratory tract infections. When we looked at the responses from people who indicated they sometimes or always receive verbal information about symptom management, 49% of those respondents indicated they never receive written information. Only 21% indicated they sometimes or always receive written information in addition to verbal information. Finally, when we looked at the 76% of respondents who indicated they would prefer to receive written information or a combination of written and verbal information, 74% of those respondents indicated they rarely or never receive printed information during their visits. So we know that in order to combat rising rates of antimicrobial resistance, we have to engage our community-based healthcare providers in antimicrobial stewardship activities. Our work has indicated that viral prescription pads can be a useful tool for helping providers reduce unnecessary antibiotic prescribing for upper respiratory tract infections. And in our survey, patients indicated a preference for receiving written information or a combination of written and verbal instructions when they are receiving care for upper respiratory tract infections. Thank you for listening, and I'd also like to thank a few groups who helped to make this research possible, as you can see on the screen there. If you are interested in more information and tools for antimicrobial stewardship in primary healthcare, we have a great resource in Canada. Please check out the Choosing Wisely Canada website and their Antibiotics Wisely Toolkit. You can scan the QR code to go directly there.